Welcome to the Marvelous Middle Age Podcast, where we are building a community of people who are in the midst of midlife, sharing our stories and learning from each other along the way. Each week, I'll have a guest join me to discuss a topic that impacts our lives and touches on some aspect of midlife. We'll discuss relationships, transitions, health and well-being, parenting, careers, and more. My goal is to encourage and support you and help you thrive as you navigate this adventure of midlife. Join me here each week for the Marvelous Middle Age Podcast. My guest this week is Carrie Brown Benn. Carrie is a family nurse practitioner and has a Bachelor of Science in Nursing, a Master's of Science in Nursing, a Doctor of Nursing Practice, and a postgraduate certification in dermatology. She's been in practice for 17 years and has started to focus more on practices to improve women's health and quality of life, especially in midlife. Carrie also has a special interest in dermatology and has expanded her knowledge of medical cosmetic practices and procedures. In this episode, Carrie and I talk about all things perimenopause and menopause. We discuss some of the signs and some ways to address them. We also talk about how to take good care of our health so we can be the best version of ourselves. I hope you enjoyed this week's episode of the Marvelous Middle Age Podcast. Carrie Brown Benn, welcome to the Marvelous Middle Age Podcast.
Thank you.
I am so glad you are here. I have to say, this is the episode I have been waiting to record. We are going to talk all things perimenopause, menopause. I just can't even tell you how much I have been looking forward to talking to you today.
Well, great. Me too.
Before we get into our conversation, can you just introduce yourself, who you are, just share a little about what you do, a little about your family?
Sure. I'm a family nurse practitioner. I've been one for 17 years, which doesn't hardly seem possible. Being in family practice, I see everything from birth to death, quite a wide variety. But as I'm aging as well, I've especially gotten more into women's health, preventative medicine. I've always had a lot of women clients, but now as I'm 46 now, so I'm starting to experience some of these things. So I've taken more of an interest in our health at this age and what we can do to be our best and feel our best. And because at this point in our lives, we usually have a million things going on, and it can be hard.
Yes, it absolutely can. We talked quite a bit before we started recording about just that very thing and what we all have on our plates, in addition to the changes in our physical, mental, emotional health. We have maybe we're caring for aging parents, or we also have kids at home, or we're, heading into our mid to late stage of our careers. There's just so much going on. And then you add in all of the other things we're going through. It is absolutely a lot. I have been a patient of yours for years, and I've always appreciated the way you have helped me through different things I've been through with my physical health. You've always taken so much time to answer all of my questions. I feel so comfortable talking with you about anything and everything. And so I was so excited when you said you would join me on the podcast, because I am definitely in I would say, the stage of perimenopause at this point in my life. And I have started digging into the signs, the characteristics, the symptoms. And what I have found was actually a little disturbing in the fact that there just isn't as much, or I think there's starting to become more conversation about this, and this topic is being more normalized, but how many women for so many years have not talked about this topic, how so many have suffered in silence and have just been told to deal with it, get through it. It's just a stage of life that we have to get through. And so I wanted to have you on because I just felt like it was so important, whether you're listening out there and you're a person going through this, or you know or love someone that is going through this, to know what they're going through so that you can support them through this. It's just really important. And again, I don't think this topic is as normalized as it should be or as talked about as it should be. So I'm just so glad that you're here.
Thank you.
So for anyone who's listening to this episode, I think sometimes the terms perimenopause and menopause are used like interchangeably, or there's some confusion about exactly what that means. Could you just kind of in layman's terms define perimenopause and then what's menopause? What do those things mean?
Sure. Well, I'll start with menopause. So the definition of menopause is no menses for 1 year. After that point, you are in menopause. If you would have any bleeding after that point, that is concerning, and you would obviously want to have it looked at. Perimenopause is that period leading up to that, and it can last anywhere from a year to 5 years. It is very variable. Every woman experiences it very differently. Some women have absolutely no symptoms. Some women are miserable. Commonly in that perimenopause range, you'll start noticing night sweats, hot flashes, heat or cold intolerance. I've seen both. It can emotionally affect you as well. It can make sleep difficult. It also starts to affect just your physical body in that your muscle mass declines even more rapidly, which it declines as we age anyway. But as you lose the hormones, then your fat mass increases. When you are lower on the female hormones, you start to gain more than in a male pattern. So that's where women are starting like, why am I getting all this weight around my waist and I can't lose it? And so it and then to that fat deposition around the abdomen is a more dangerous type of fat because it can get into the visceral organs, and then that impacts our health. So there's a lot going on.
Absolutely. Another common sign or symptom I've heard women talk about recently is this brain fog.
Yes.
Where you start becoming a little forgetful. And I think some people I've talked to thought, oh my gosh, am I having cognitive decline in terms of some type of a dementia or something? And we're very alarmed by that, only to find out that no, you're not. And brain fog can be a sign or a symptom of upcoming, menopause, or that you're in perimenopause, you're heading down that path. There's just so many different things that I think can affect us in this stage, and it doesn't always totally seem related. So you're like, what's happening to me? Why am I gaining the weight around the middle? Or why I've heard of joint pain can be a sign. There's just so many different things. And so all those things can start to make you very concerned about your health. So to know that, of course, you want to get any symptom that's sudden or alarming checked out, but that this could be what it is potentially.
Yeah, no, you're right. The brain fog is big. And along with it, I think like you mentioned, at this point in our lives, we have so much going on. I think there's so much in our brains to keep track of. Our schedules, kids, parents, appointments, it's very overwhelming. And then not to mention too, periods can become very very erratic, very irregular. For some women, they can get very, very heavy, and then they get anemic. And I mean, it just, again, there's
snowball effect.
It snowballs. Kind of. Yeah.
Gosh. Well,
and age wise, the average age of menopause is 50. Perimenopause, though, I've seen some women start as early as late 30s, early 40s. So it's again, there too, it's very variable.
Right. And if you've had any kind of surgery where ovaries are removed, that will put you into, that put you into menopause?
Yeah, it throws
gosh.
essentially, if both ovaries are removed, it's called surgical menopause. I mean, it just immediately throws you right into.
And I know women in their 30s that have had to have that done. And so they're in that, right, like you said, very quickly put into that. So it's a lot. It's a lot. So if you had someone come in and they were describing, like, how do we know if we're in perimenopause, in the sense that we have all these weird things happening to us? What is a way that a clinician would talk someone through that or evaluate them to see if, that's what this is? How would we know that?
No, good question. Because I get that a lot. A lot of women come in and they're like, I want my hormones checked. Right. So if you are in menopause, officially done, there is very definitive changes in your lab work. So you can look at that and say, you know what? Yep. The labs show you're done. Right. Perimenopause is a different beast. The hormone levels can be all over the place. So, I mean, if you're going to be considering some hormone replacement therapy, which we can get into later, obviously checking labs and things like that is important. But otherwise, the Gynecologic societies recommend more just going by symptoms, which is a good thing, because this is also too something in healthcare. We just look at the number and it's like, oh, your number's normal. No, you're fine. Well, symptom, right, like treating the person and the number. So really in that peri phase, if someone comes in and says, yeah, I'm having night sweats and my periods are all over the place and I can't remember anything, and I can't, it's like, that's probably where you are.
Sounds like it. Yeah, exactly. Well, and for women, our hormone levels on a daily basis can change. So if you're in perimenopause, even measuring them, it's like kind of trying to throw a dart at a moving target. Like you may hit the lab at the moment they're down that day, or you might hit when they're at a more normal level that day. And so I can see where that would be a lot harder to determine. But yeah, given what you said and kind of looking at the symptoms and maybe ruling out if there's something else going on, you can be kind of assured that, yep, I'm there. I'm in it. Right. Exactly. So we mentioned HRT. If someone is, experiencing some things, or how would someone determine if they're a candidate for hormone replacement therapy, or would you evaluate someone on that?
Sure. And there's a lot of different options out there when it comes to it. Obviously, you like you said, need to make sure you do a thorough assessment, make sure there isn't another explanation for, like, well, why are my periods all out of whack, or right, this or that, especially if it's someone at a younger age where you wouldn't be expecting this going on yet. Really, a lot of it depends on quality of life. I mean, how much it is affecting their quality of life. For some women, they're like, yeah, you know what, I'm feeling these things, but it's not that bad. I can do fine with it. Whereas, like you mentioned, friends who've been like, oh my God, I think I have early onset dementia. Right. So if it's really impacting their quality of life, and then you have to sit down and figure out what's right for each individual person, look at their different risk factors, because any type of medication or treatment comes with risk. You have to weigh the risk and benefit. Although the more I'm learning about some of the bioidentical hormones, more natural treatments can pose some lower risk, which is nice, which opens the door up for a lot of women. And then also going way back to when hormones got such a bad rap with the WHO study, and everyone was just petrified of them. And actually, it's not as bad as what that study had showed. Actually, the authors of that study have come back out with some other data that they've pulled and have said, oh, shoot, we may have jumped the gun on this a little bit. But it thoroughly scared everybody. And the attitude, I don't think, has shifted really back since. Right. So, but you just have to talk through that, and make sure women are up on their screenings, make sure they're up on their mammograms. Obviously if it's a woman who's had a history of breast cancer, you would not want to be using hormones, but there's some other alternative options though. Right. And there are other options if a woman can't have hormone, or I have some people who are just like, I don't want hormone. There's some, off-label use of some neuroleptics, antidepressants, things like that, which actually can be very effective for like not just the mental symptoms, but the physical, the hot flashes and night sweats and, those type of things as well. And then also lifestyle is a big one, making sure you're eating well, trying to maintain a healthy weight, exercise. They find women who are at a more healthy weight do tend to ease through menopause easier, although it's not a guarantee.
Right.
And then also too, there are some supplementary things that there have been some studies that have shown benefit, but then also some studies that have disproven it. You have the two sides to each, but first mantra, do no harm. I always think, so if I'm recommending something, I'm like, okay, is this going to at least be safe for them to try? They can try it, might not help, but it won't hurt.
Right.
So black cohosh is an herbal that can be beneficial. I've had some women who are like, yeah, that really seemed to help. And I've had some women who've come back and been like, nope, that didn't do nothing.
Right.
Dim is another herbal, which can be supportive during that time. Soy, isolates, not necessarily processed soy, but if you like edamame or things like that in your diet, that can also be helpful too. It has almost like an estrogen kind of mimics effect in our system. So there's a myriad of options.
So we were talking a little bit before we started recording about, just kind of that whole attitude about women just getting through this time, right? That back in the day, there's so much conversation as we're growing up, as we're approaching puberty as women, what happens then? And then if you have a baby, there's all this information about pregnancy, of course, which as there should be. But in this particular case, I feel, and I think we both kind of agreed that historically there has just not been the conversations around menopause, and that women have been told, just deal with it, that sort of thing. Do you see that conversation changing, and some of the things that you are seeing out there?
Yes, definitely. It's improving. There's a little ways to go, like we talked. The historical attitude of it, like I was telling you, my mom made the comment when she learned I am working on, in my practice, doing some hormone replacement and things such as that. And when she learned that recently, she was like, well, why do you need to do that? If you can't get through menopause, how will you prepare for death? And I'm kind of like, Mom, you're comparing going through menopause to dying. I don't really want to feel that in my late 40s, early 50s here.
No.
So, but that she's 84 and that was the attitude. You just suffer. You just suffer through it. And even in our medical education, my nursing education, and I feel medical education, unless you're maybe more specifically going into women's health, there, like you said, you get all kinds of training on like, oh yeah, menarche and starting menses and pregnancy and learning about pregnancy and this and that and menopause. Oh yeah, this is what it is. And this is about when it happens. And that's about what you get.
Wow.
So it is lacking. And so I think we come out as new clinicians with not a whole lot of understanding of it. And then personally starting to go through it. I think puts a whole new spin on it as well. Not to say that male providers can't be open and sympathetic, but I feel as a woman, you have a little bit of a different take on it. I have a friend who's going through this, and she mentioned to her provider that, she's not sleeping well because of all this, and it's a male provider, and his advice was, well, we'll get you into counseling.
You know what? That is, and again, nothing wrong with counseling. I do counseling, nothing wrong with that. But I have heard, it's funny you say that, because I have heard so many people talk about their provider's first response to this is, let's put you on medication or you need to see a therapist. Not looking at, oh my gosh, okay, maybe there is something else going on here with perimenopause, menopause, what have you. That's the response. And yeah, I mean, again, just the approach or lack of an approach to really addressing what's going on here. She's basically being told, well, you've got a mental health issue, not a physical health issue that has to do with the stage of your life. And feeling she probably felt a little dismissed there in terms of that, which is not a great feeling either.
Yeah, very much, because that's definitely not what she was
No.
No, I feel I'm doing okay there. But,
Right.
Well,
right.
and then speaking of mental health, I mean, and that is a huge piece of it too, because it does affect how we feel mentally, and not to discount that, antidepressants do help and can play a role in therapy and whatnot. It's a tough time of life. So not that those are bad choices, but it's not the only thing to consider.
Right. And then and when, you go to your provider, you're looking for them to, give you some answers or give you some next steps. And that's the only thing they offer. You kind of feel like, well, what in the heck do I even do here? And again, because I think, as we talked about, the lack of information, or at least it being out there widely known, people were like, well, okay, I guess I could do that. But, so again, I hope, like you said, this conversation, this broader conversation about menopause continues to grow, and that change continues to happen, and that training in clinician settings and medical settings changes around this, so that more providers are informed.
Yeah. I think as we become hopefully more vocal, and I think women are taking more charge of their health and looking for some of these other methods to help how they feel. Because again, we're just so busy at this time of our lives. It's like, I don't have time to feel like shit.
No, I can't take another day of this. No, it's not.
Exactly.
Okay.
And two, I think, as with time, versus our parents' generation, I think we feel like we can stand up for ourselves more.
Yes.
As us working, we have our own money. It's not where, I have to go ask my hubby for the money if I want to go do this hormone therapy. And they say,
I can do this myself.
And they say, no, suck it up. So, I've heard that too. Actually, I was doing some incontinence therapy, or a treatment to try to help with like stress incontinence. And I'm not working on it anymore, but it was an out-of-pocket expense. Insurance didn't pay for it. And a lot of women I talk to, and especially if you had a baby, it's like, oh my God, I would love it if I didn't pee when I sneezed or coughed or whatever.
Right.
And I'd like, well, how much is the treatment to do? And I'd tell them, and I'd ask them a second time, like, hey, and a lot of their answer was, let me go talk to my husband about it. Let me go. And several of them were like, no, my husband said for that much money, I can just keep peeing myself.
Oh, for gosh sakes.
Yeah.
I just don't, I don't want to go down
that's
path.
a different rabbit hole.
However, that to me, I think though, that statement is representative though, I think, of what a lot of women encounter, whether it be talking to someone about this or going to a provider who maybe doesn't have the education and training or the perspective. I think a lot of people get that type of response, and it just feels so invalidating and frustrating. If you have something that is impacting your quality of life, and yes, if you've had a baby, that sort of thing happens. And if people are saying, and it doesn't happen to everybody, but for a lot of people it does. And you're getting that kind of an answer on top of experiencing the physical thing you're experiencing. It's just this invalidating kind of, well, okay, and we just don't need that. In addition, like you're saying, all the other things we have in our lives, we don't need that type of treatment or that type of response. So if you're someone listening to this and maybe you're not going through this, but you love someone that is, or someone that is, learn about these things so that you can support them in the way that they need to be supported, but not dismissing them, not dismissing the symptoms. That's super, super important. Absolutely. So we've been talking briefly about menopause and perimenopause, and that, again, in middle age, that is something that so many of us are dealing with, and like you said, to different extents. Some people I've talked to have had very little symptoms, very mild. Some are really going through a lot of things, or pretty severe symptoms. But when you think about overall women's health and you think about in middle age, some of the things that we can be doing, and you talked about, some of those things in terms of just overall good, healthy habits, preventive exams. Can you just give us some simple, straightforward things that we can be doing to take good care of ourselves in middle age?
Sure. No, I mean, a big one is just getting your regular checkups, every year. Get in there, get a good once over. Pap smears aren't recommended as frequently anymore, but it's always important to have like a pelvic check and a pelvic exam. But then obviously making sure you're up on your pap smears, mammograms starting at age 40. And even depending on family history, sometimes I'll start them a little sooner for some women. Colonoscopy at 45 now. So that's a change that not everybody loves, but it's important to actually biggest growing sector of new colon cancers are younger women. So that is very important.
Good change though, I feel like. Yeah.
So that, and just overall, trying to live healthy. I know nobody's perfect and we all have our vices but, what we eat is huge and our world, this is a whole another topic as well. Our world is designed to, it seems like fight us in the efforts to eat healthy. I tell people like you walk into Walmart and there's a huge big display of Oreos sitting right there and this, that,
there they
and
are.
So it makes it hard. But that is a big piece of it. And then also exercise and strengthening. I guess I can't stress enough. Strengthening is very important for us women as we get older. As I mentioned before, the loss of our muscle mass, which that is our metabolism. Muscle is what burns. And if you're losing muscle, but continue to eat the same, well, you're going to be in a calorie positive situation and you're going to put weight on. I hear it all the time. I've not changed a thing. I eat the same as I always have, and I'm gaining weight. Well,
there's a reason for that.
There's a reason.
Yeah.
You're losing muscle. So you do have to change up as you age. Your calorie requirements may be less. And if you're trying to lose, tracking your food is huge as well, which I always get a lot of pushback too, that it's a pain in the butt, but the people who are the most successful are the ones that track.
I can speak from personal experience on that. With my weight loss journey, tracking was every single day was imperative for me to know where I was at. So I can back that one up with personal
I always tell people you underestimate, because a lot of people are like, I know what I eat. I know what I eat. And I was like, maybe you don't.
Right. Well, or some people, I think sometimes, we're in that diet less is more mentality. So some people even will eat, not intentionally, thinking, well, I'm eating, this many calories, and they're not actually eating enough to really fuel themselves, especially if they're doing the strength training and exercising. And so their body isn't going to, it's going to think, well, you're starving me. I'm not going to lose this fat because you're not eating enough. And that was actually something I was quote unquote dieting, and I wasn't seeing the results. And I'm like, when I actually increased my calories in a healthy way, right? Protein primarily was what my focus was. I was working out, strength training, and that's when the weight started to drop. So
yeah, exactly. Yeah. You definitely don't want to
Right. You need to find kind of that sweet spot.
Yes.
And sometimes that takes a little, and the tracking though, as you said, is key, because then it helps you to really know where you're truly at and where your sweet spot is. And you can't do that if you don't know. So tracking is key. So I'll get off my soapbox now.
That's a big one. And then to, mental health, obviously is a big one. Is seeking counseling if you need, because again, it's a time where we have so much going on. It's getting good sleep, but again, some of these things then can interfere with getting good rest. Right. So it's all a continuum. So yeah, those would probably be the big.
Well, and I tell people all the time, you can't pour from an empty cup. And as we've talked about, we have a lot on our plate in this stage of life. And when you're not taking care of yourself, which I think for a lot of us women, we tend to very easily put that on the back burner because we're caring for so many other people. If we're not taking good care of ourselves, we can't take good care of others the way that we would want to. So if we're not eating well, getting good sleep, moving our bodies, taking care of our mental health, getting our preventive exams, and having our health be in good shape, the best that we can, it's harder to care for other people, And I've always been of the mindset that, I want to be able to control any factor that I can. I can't help my genetics, right? That I'm born with, right? If there's something in my DNA that might make me predisposed to something, I can't do anything about that. However, I can control certain things, staying at a healthy weight, getting my preventive exams, eating well, exercising, all those things. So let's just all control the things that we can. And sometimes things just happen to us in our health. And some people are dealing with chronic illness or different disease states that, that just happen. And so let's just take good care of ourselves so we can, live to our best and our fullest and thrive,
No, exactly. And that's huge. It's hard to care for others when you're suffering yourself or you're not caring for yourself.
Absolutely.
And that goes to speak towards our system, our healthcare system, which again is a whole other topic, but it's so reactive. We wait for people to get sick.
Right.
We definitely need to focus more on preventative and
Yes.
keeping people from getting sick. And like you said, there's sometimes things happen that,
Right.
but I think I was reading somewhere like 75% of chronic medical conditions almost probably could be avoided. It's due to lifestyle and things that are in people's control.
Right.
I mean, there's conditions are not within people's control
Absolutely.
at all. But so it's a systematic change, I think, that needs to shift to, like you said, and a change of having these conversations and being more knowledgeable about what we can do to help ourselves feel better. And so...
Absolutely. Absolutely. Yeah. And, you were talking about preventive exams, and I think some people are, you kind of hear the horror stories of people who have uncomfortable mammograms or colonoscopy prep, which, you hear all about that and everything, but it's really, again, and there are always going to be those outliers of people who have those uncomfortable experiences. But for most of us, it's not like what you hear. And I would just tell anybody out there who's been putting off getting some of these preventive exams, whether it's an annual physical or a mammogram or a colonoscopy or something else, just make the appointment and do it and experience it for the first time. Know how it is for you. I shared with you, I had my first colonoscopy in October, and it wasn't as bad as I thought. You hear all the horror stories of the prep and this and that. And I got done with it and I was like, well, that was that. Big deal, and I was reassured. They give you results right there and walked me through some things. And I'm like, this was not what everybody said it was going to be. Like the fear, I think, of some of these things. I also heard before I had my first mammogram years ago, it hurts and this and that. And I know some women do have some discomfort, but honestly, not bad. Really just not. And the where I go for mine, they just make it such a comfortable and warm experience that, it's reassuring to know that you're doing okay and you're getting those exams the way you should be. So I would encourage anybody listening, if you've been putting it off, don't do it any longer. Make the phone call, get the appointment on the calendar, and get it done.
Yes, definitely. And to the mantra, if you have a bad experience, you tell 10 people, and if you have a good, you tell none. You always hear the horror stories.
Absolutely.
The worst of these things, and which is very rare. So.
Right. Very much the outlier. So take care of your health and get those things handled. Absolutely. Well, before we end, I always ask every guest 2 questions, and these are more for you personally. We could probably talk about menopause all day, but one of the questions is, what is the best thing for you about being in this stage of your life? What's something that's just great about it for you?
Oh boy. It is nice. I've gotten to an age where I really don't care what anybody else thinks anymore. It's
freeing.
It's very freeing. When you're young, you're always so worried about what does everybody think? And, I just, I'm going to do what I'm going to do. And
The rest of it, whatever.
Exactly.
I love that.
No, yes. And addressing some of these things probably was one of the best things that I could have done recently too.
Yeah.
Just personally, you know, in my practice over the last few years, I've had more and more women coming in with, you know, we'll go through their meds and this and that, and they have, some different hormone therapies on their list, like testosterone pellets or estrogen or some thyroid replacement. And I'm like, well, what's this? Where are you getting this? And I mean, why did you do this? And they're like, oh gosh, yeah, because I was miserable and this and that. And I'm like, well, is it helping? How do you feel? And they're like, oh my God, I feel so much better. So just speaking up and like seeking out treatment.
Right.
And so personally, I was experiencing horrible night sweats, which was affecting my sleep. I was starting to get daytime hot flashes, definitely the brain fog, and with everything going on in my life and teenagers and my job. And it's like, oh, I can't have this.
Right.
And then just too mentally, emotionally, it was affecting everything. I was just getting so negative and just hated everything and too fatigued, tired. I was just so tired. My husband would always comment like, God, all you want to do is just sleep. So I sought out care myself last fall and have now been getting some supplemental treatment, and it has been
game changer.
Love
that.
Love it. And you know, and it's one of those that, again, the typical medical establishment, a lot of them think it's total BS doing some of these things. And, which that, honestly, my attitude may have been there at one point, maybe 20 years ago before I was feeling these things.
Right.
But you know, I'm like, you know, as long as it's not hurting me.
Right. Exactly.
And a lot of it is very research based, and the studies and safety studies. And, as long as it's not hurting me, if it's making me feel better, I don't care.
Right.
If it's all placebo.
Right.
Effect. But
I
honestly, I don't think it is.
If it's improved your quality of life, then that's all that matters. And I think that gets back to that freedom that you can now feel in this stage. Like, I don't, you know, this is helping me. I don't care what you have to say over here. It's not hurting me. It's helping me actually to live the quality of life that I want. I'm going to do it. Well, like, whereas you said maybe 20 years ago, you might've been like, well, I don't know, or so-and-so said not to. And I think those things hold us back. Whereas now, as we get a little bit older, it's like, no way, I'm doing it.
Yep.
I'm looking out for myself. I'm
going to do what I need to do to make for me and to feel better, and not apologize to anybody about it, not ask permission for anybody about it. So.
Nope. It's our life. It's our health. We need to take care of it. Absolutely. So speaking of kind of being in our 20s, if you could go back to Carrie in her 20s, what would you want her to know about this stage of life? Is there something you would want to share with her about being in your 40s, your fabulous 40s?
Fabulous 40s. You know, that is a tough one. Because even in my 40s, I still try to act like I'm in my 20s.
Well, yeah, we're still cool.
As my friends would tell you,
we're hip, we're cool, we're with it, right?
Yes,
I mean, come on.
So, you know, that is a toughie. I'd almost want to go back to my 20s and give my 20-year-old self some parenting advice, like things I would have done differently.
Here's some things to know.
Yes, here's some things you are.
I love that though, but that's true. I mean, because in those ages we don't know, especially with our first one. We're like, what am I doing? How did they let me walk out of this place with this little tiny person? Yeah, and I'm supposed to take care of them now. Absolutely, parenting advice. I love that.
Yes. I there too. I probably would have said, just get out and do what you want to do now. You know, I didn't have kids super young. I was 27, but still, you know, now I look back, I'm like, oh, I wish I would have went more places and traveled more before I had kids. And, you know, because it's
a little harder once the kids are older, especially once they're in school and things like that. So yeah. Do it while you're young.
Do it while you're young. Definitely.
Absolutely. You don't have the constraints of the school year calendar or, you know, the rigor of work too, you know, and making it harder to take time away for sure. I love that. Well, Like I said, we could probably talk all day about this, but I am so appreciative of you coming on. This has been such a great conversation. I know it is going to bless so many people to hear you talk about this. And I really hope that it spurs people on, not just to take better care of themselves in general and do the preventive exams, but if you're having symptoms or signs, talk to your medical provider, do some research. I'll put some links in the show notes to some of the things that you mentioned for people to try to learn a little bit more. There'll be reputable sites because there is so much on the internet about these things, and you really need to do your homework and make sure what you're pursuing is sound medical, research-based, as you mentioned, study-based, evidence-based things. But talk to your provider about this. Don't suffer in silence, especially if you're having severe symptoms that are impacting your quality of life. It's just not worth it anymore.
No, definitely when there's good options.
Absolutely.
Nowadays.
I love it. Absolutely.
And there has been for years. I mean, a lot of these things have been used since the 1930s for treatment of menopausal symptoms. And then,
it's just not been out there for people to pursue. And as you mentioned, kind of the system, the way things have kind of gone over the years, it wasn't really at the forefront. But again, I'm really hopeful. The conversations are starting. It's slowly starting to be. There's a lot of rumbling and noise happening now, which I think is a good thing. So I hope it keeps going.
Definitely.
Thanks again, Carrie. I really appreciate being on.
Thank you.
If you're enjoying the podcast, please follow the show to make sure the latest episode is on your podcast feed each week. I would greatly appreciate a rating and a 5-star review on the podcast platform you're listening on. It helps others to find the show. If there are topics you'd like me to discuss on the show, please email me at themarvelousmiddleagepodcast@gmail.com or direct message me on Instagram at Nicole Stute. Thank you for listening.